All right, hey everybody, Dr. Perlman from Paramount Chiropractic Wellness. And actually what I want to do is one of these voiceovers. I got a lot of positive feedback from the last time I did this. So rather than me being my quirky self and editing the video, what I'll do is I'll take basically 5 minutes of the footage and go through it like a case study, in the sense of me kind of taking you through exactly what's going on in my head when it comes to taking care of this particular patient. This person that's about to come up is a football player, former professional arena league player, collegiate athlete, and he is, getting closer to 40, but dealing with just really debilitating back pain, can't really make it through workouts, can't squat or deadlift without muscles going into spasm afterwards or during, if his back is starting to lock up. So really he came to me like seeking to be able to sit in his car, look over his shoulder, and be much more functional, because even moving his neck was impacting his back. What I'll do is I'll attach some x-rays to go over some things that are applicable to his case. But for now, in terms of what we'll do is going through this 5-minute video. So it starts off where I am analyzing through my visualization and scoping what we would call instrumentation in the Gonstead system. And when we're doing this, we're really, in all honesty, just looking for the heat component of inflammation. So when I'm doing everything that I do leading up to deciding where I'm going to adjust on a particular day, on a particular level, on a particular patient, it all boils down to the components of inflammation. So if a joint is irritated or inflamed, it's going to have heat, which is what the instrument picks up, the nervous scope, redness, swelling, also known as edema. It's going to have loss of function. That's that range of motion that's not properly, happening at that joint, which over here I'm checking for the range of motion and the quality of coupled ranges of motion and lateral flexion, rotation, extension, and flexion of each joint. Once I have that, kind of made up in my mind, clinically, when all those indicators are pointing to something that is determined, this area needs to be adjusted, that's what I'll do. So right now in this part of the video that I left, the original audio, is I'm talking about if you were going to do heavy lifting, you have to be okay with reducing the amount of weight in which you are lifting, or the intensity in which you lift that weight that often, because that's probably the only way for this person and people with injuries like this and spines like his. The only sustainable way is to reduce the load, reduce the volume, and reduce the intensity. And if you wanted to still lift heavy weights, you certainly would have to reduce the volume and reduce the intensity.
Let's say 3 times a week, 2 of those days are actually fairly intense and heavy, but half the reps you normally put in, right, and be okay with that. Feeling like leaving the gym, feeling like you almost did nothing.
So the last point I made was about how you would leave the gym feeling like you did nothing. So it's a shitty feeling for somebody who's used to going hard, for someone who's played at a collegiate level or professional level. You don't want to leave the gym feeling like you haven't accomplished anything. But in this particular circumstance, you're not going to get any longevity out of continuing to push yourself to that level. So that adjustment right there, which we'll go ahead and actually look at it again. So that adjustment right there is his L1 vertebra, specific contact, bilateral lamina contact, or bilateral TVP. So that was a bilateral lamina, double TVP, thenar contact, with actually that's locking the abdominal breakaway piece to reduce the amount of extension. This person was adjusted actually 7 times over the course of a month. So from like February 1st, let's say, might have actually been the very last days of January, but up to the very first week of March, we'll say he's been adjusted 7 times. And in those 7 adjustments, we've always worked in different combinations and different subluxations. In particular, the major that kind of started off this cascade of what I call optimal healing was a PI-IN listing on the left side of the pelvis, which was the problematic side causing spasms. And then we did a lot of work on 4th and 3rd lumbar with the drop away piece, the abdominal breakaway piece, going into like full extension and prone adjustments, along with a lot of adjusting in the thoracic spine and upper cervical as well. And then in this particular case, in this particular visit, does work on the sinuses, TMJ, and 6th cervical on the right side of the neck because he had been having some, upper respiratory like symptoms. And usually when someone has like a sinus infection or some kind of an upper respiratory thing going on, we'll typically very carefully work in the cervical area. And over here we have a giggle about the way that it's set, which is almost like a quick, not so deep, but actually like a shallow thud. So for me, I think it's always funny when I'm trying to get a certain particular quality of adjustment. And he knows it as well. He's been my patient now for like over a month, and having a fairly aggressive adjusting regimen for him, which most people that actually come here know that's extremely uncommon. Most people that aren't really in that rough a shape, I might only see them about 4 times in a month. He was already up to 7 times during that 1 month period. And but obviously his case was unique, as you've heard me talk about in other videos, where he was that acute. We really had to put work in to get him out of his old habits of certain kinds of stretches he was doing and therapeutic things that were the anti-therapeutic, and really responded well, to adjustments and changing his extension bias exercises from being very active to a bit more passive, i.e. the lacrosse ball, foam roller, releasing the psoas and the glute medius muscles, and then properly reactivating the glute maximus muscles. And we are now at the point of our, how should we call this, rehabilitative or functional movement protocol, where he's now going to be going in for some like passive movement therapy to someone else that's kind of within our team, not in the same office, but somebody that I believe will help immensely when it comes to actually putting through the actual proper biomechanic proprioception, but passively, to gain lumbar flexion, to be able to allow the discs to not be so irritated as they stretch beyond the anatomical integrity. And again, lastly over here, you're just seeing a lot of what's like really like a soft tissue, or reactivating the jaw muscles, which is the temporalis and the masseter muscles, along with the work on the upper sinuses. So closing, there it is. That's what it looks like to get a specific Gonstead adjustment, along with a little bit of soft tissue in the upper cervical, upper sinus, and eustachian tube, and muscles of mastication. The muscles associated with chewing, the TMJ muscles, that's what it looks like here. Feel free to give us a call. Let us know if there's anything we can ever do for anybody. It's Dr. Perlman.